Rodriguez, MA, Education Coordinator, and from Valley Caregiver Resource Center. Welcome, Susana.
Thank you so much for this wonderful opportunity to be among this wonderful panel to share as we continue the conversation about resources for family caregivers and for our seniors here in the Central Valley. I will be sharing here shortly a PowerPoint that will provide us here just some information here on just what's available and how are we providing this locally to our family caregivers. Thank you, Dr. Helen Miltiades, for reviewing this important topic of caregiving today, especially during this time of COVID. I'd like to focus on the family caregiver and senior services, as I mentioned. With caregiving today, we have, as just to add to some very important facts about caregiving, an estimated 40% of caregivers report feeling overwhelmed today with nonstop nature of being in the caregiving role. So we find many caregivers, even beyond what we are currently experiencing with COVID, continue to feel overwhelmed, stressed, and there's many different emotions that caregivers may experience with caregiving. But I do want to start this conversation here in the time allotted with the services. Next month, as important as this discussion here is today, is National Caregivers Month. There is also, besides here, the slide for the National Caregivers Month of the Caregiver Action Network, the topic of caregiving in crisis. Find interesting that the quote here, family caregivers manage health emergencies, juggle priorities, and suffer isolation. All of that was even before COVID. So here we're talking about COVID, but so many caregivers, and this is the reason that Valley Caregiver Resource Center continues to provide services to family caregivers because the pandemic brings even more challenges as caregivers handle caregiving in crisis. So there are some other just here notes on what you've talked about, video appointments, telehealth has been new. I am a caregiver myself for my mother and helping and assisting my mother as she has telehealth. This is so new to her, finding for the first time how to text. So I can definitely relate to many caregivers today having to connect services and assist their loved ones in their home. Also, the question that is so hard not to be with mom as I work full-time, for many that are working full-time and managing and juggling caregiving as well. Also resources that due to our current pandemic may have increased even more so financially, some hardships for our family caregivers. So I do want to state here, as we look at this for National Caregivers Month, to honor all those that are listening in today, that you're at times maybe not there to want to be recognized. Sometimes we don't go and do help our loved one or assist our loved one because we want some recognition, but we want to let you know today that you're not alone, that we're thinking about you as a nation, we're thinking about you, and you matter to us. So I just want to leave that, because I think that's so important, especially as we go in next month. But it should be every month that we recognize our caregivers and their dedicated, heartfelt work that they do and support for their family members. We, in our statewide program, which Valley Caregiver is part of. There's 11 Caregiver Resource Centers in the state of California. We are doing a campaign. I did want to mention this here, November 19th, Navigating Your Caregiver Journey, as I just talked about National Caregivers Month, which will continue the conversation on looking forward to provide tips and resources and additional help and assistance for self-care. The information will be provided in the resource information that Rebecca will be sending later to the participants. As I go through some of the services that we offer here with Valley Caregiver Resource Center, again, we provide throughout the Central Valley help and assistance for seniors, family caregivers, and their family members. I'm going to go through a couple of our programs and highlight today, especially as we talk about caregiving during COVID. The Caregiver Resource Program, which is part of the statewide program, we provide services to family members who are caregiving for a loved one who has been diagnosed with an adult onset the brain disorder, cognitive impairment, or caregiving for someone of 60 or older, regardless of their diagnosis. So this is key. Most of our services are free to family caregivers, and I'm going to share what those services are and currently how we're continuing to provide that for such an important part of the journey that caregivers take. We do cover 9 counties from Stanislaus to Kern County, so that includes all of Fresno, Kern, Kings, Madera, Mariposa, Merced, Stanislaus, Tuolumne, and Tulare. So any of who are here today find themselves caregiving for a family member with those two either or qualify for services. We are a nonprofit that provides services that include consultations to the family, help with care planning, both from early stages to late stages of care. We work closely as well with David, who's going to be presenting here shortly on long-term care, but their long-term care can be defined as resources brought into the home. And we will meet with family to discuss what are some of the options, services they're needing, if it's transportation, if it's in-home care options. We do provide online at this time caregiver support groups. We do offer support groups in our various counties, but at this time we're doing those virtually. We also do provide caregiver education on offering to our family caregivers on self-care, caregiver burnout, caregiver, coping with the care, grief, also dementia care, long-term care planning. And these, again, are available to any of our caregivers who participate in our program. There is no cost to attend any of our educational classes. We do provide short-term respite, which many times I do want to highlight this for many who may say, well, I may not qualify because of my income. We do receive state and federal funding that can help family caregivers with short-term respite. What does that look like? We do contract out with various agencies throughout the 9 counties that can help for a couple hours periodically to relieve the caregiver. And that may be to attend a support group, to follow up with the doctor, to sleep. We may have some caregivers who haven't had a good night's rest. So this is where respite, and there are protocols, especially because of COVID. I know there's Dr. Miltiades had mentioned there's concerns about bringing in someone. We do have a couple different options how we can provide the respite that's available. Also, there is short-term counseling that's available for the family caregiver. Our client, primary client, is the family caregiver. We want to make sure that the primary caregiver is doing well, managing with care and also with self-care. So we do have 6 sessions of counseling services that we offer to the family caregiver. And one other service that I'd like to also mention is the importance of legal and financial consultation to family caregivers who are needing to review healthcare directives, powers of attorney. We do offer a 1-hour consultation with an elder law attorney as well. Now, to to just briefly review the next couple services, just to let you know that I'd mentioned the Caregiver Resource Program. We also do have three other programs, Oasis and PALS Adult Day programs. Currently, we are closed due to COVID, but we are offering new services to family caregivers and loved ones who have had a diagnosis or early stage of Alzheimer's or other related dementia. We're offering with PALS and Oasis virtual activities to those that do have dementia. So this is a weekly activity that your loved one can participate at no cost. We also are offering a telephone reassurance program to all seniors, and there's follow-up calls to the senior who might, again, we've mentioned isolation earlier. This is a great way to connect and just check in, making sure, because sometimes a lot of our seniors may not have someone that can do that one call to check in to see how they're doing. Again, these are services that we are providing currently to our family caregivers. Our next program is the Health Insurance Counseling Advocacy Program, which is HICAP here, which provides free unbiased counseling with Medicare. This time is a very important time for Medicare counseling, a review of benefits, your rights, long-term care appeals, open enrollment. Unfortunately, there's scams that happen too much to our older adults. And so being able to be informed is so important. We do offer, and we are offering at this time virtually or by phone for those that have questions on long-term care insurance as well, or any questions regarding their Medicare. I think this is such an important tool and resource because there's so much confusion. Here recently went to a doctor's appointment with my mother. She was denied a service with Medicare. And so right away, I thought, I'm going to check in with HICAP because I'd like for them to advocate for my mother. And this is actually what I'm doing next week. So here, know that there is a place so you can advocate, as have someone follow up with you and just learn what's the best drug prescription for you. And if there's any questions, please, again, it's free counseling available here in Fresno, Madera. Lastly, we have the Fresno Madera Long-Term Care Ombudsman Program, an important program as well that's offered here in Fresno Madera that is available for residents of skilled nursing and residential care facilities for the elderly. Our long-term care ombudsmen are trained and state certified caring advocates for residents in our long-term care facilities throughout the Fresno Madera. Ombudsman at this time, our state ombudsmen are visiting here. We are in the going through a stage, next stage where we'll have volunteers, but currently our staff certified ombudsmen are doing follow-ups with the investigations of elder abuse in long-term care, or to also witness powers of attorney for health care in skilled nursing facilities. Lastly, I'd like to just again here come back to invite anyone that is joining. We are jointly putting this next conference, Virtual Alzheimer's Caregiver and Wellness Conference with UCSF Alzheimer's and Memory Center, and also the Alzheimer's Association with Valley Caregiver Resource Center, which will bring information and resources to help families who are caregiving for a loved one with Alzheimer's and self-care. Thank you so much. I look forward to answering any questions here later on in our presentation. Thank you.
Thank you, Susana. Thank you. So much information. Thank you. There's so much, and you all offer a lot, and we're definitely going to send a big packet out with lots of resources from the Valley to all the attendees today. So just a little reminder. And now I'd like to welcome David Reed from Assured Living Solutions, and he's a senior care specialist, and he's spent years in senior care and has a great passion. And so he's going to present right now. So welcome, David.
All right, good afternoon. Great to be among colleagues and champions that work hard to make sure that our aging population is connected with resources, but more importantly, that their voice is heard. So thank you for having me today. What I want to do is kind of present an overall picture of kind of what's going on with assisted livings and skilled nursings, residential care homes when it comes to COVID-19. Let me go ahead and do my screen share for you. I just have a simple outline. Here we go. And then share. So when it comes to looking for an assisted living or residential care home, obviously because of COVID, everything is done virtually. So, and it's unfortunate because this is a very personalized and individualized process, but we all have to be flexible in this pandemic. But when we are looking into options, of course, we do want to tour and put our eyes on where we're considering for a loved one. So a lot of times facilities will do virtual tours, FaceTime, kind of whatever is most convenient for the family. Also, there is some places are doing in-person tours. However, those are usually done outside. If you do go into the facility, it's usually you're using a direct entrance into the apartment or the room. And then also just continue to follow the recommended safety procedures. When you're moving into an assisted living facility, COVID testing is strongly recommended, but it's not a state requirement. And I'll talk about the state requirements later. And some places, and families should be aware of this, that some places do require a 14-day quarantine. And then also another thing to think about and families to be aware of is ask that question, who can be involved with moving my loved one into an assisted living? Because obviously, visitors are limited, and so who can be in physically in the helping with the process. With social distancing within an assisted living, families should be aware that dining services are not happening anymore in the larger facilities. They are delivering meals into their room, and of course that kind of starts to bring up the concern of isolation, right? So again, for families, it's so important just to be present and aware of what's going on. Social events, they are happening, but a lot of times they will do kind of hallway bingos. So residents might be at their doorways, but activity directors are still there calling out bingo through the hallways, or even I've seen ice cream trucks going from door to door delivering ice cream. So I really have a sense in the assisted living world or skilled nursings that staff really truly do care for the residents, and they are really trying to do what they can as far as being creative to ensure that everybody has that opportunity to be social. When it comes to memory care facilities, and we're talking about a population that doesn't have the cognitive ability to understand the social distancing guidelines, it's just a simple best effort case. I talked to the state just the other day about this, and again, it's just there's really no firm guidelines when it comes to memory impairment and social distancing, but again, it's just lies on the facility's shoulders to provide best efforts. Visiting your loved one during an assisted living, visiting your loved one during COVID-19, that I think this is probably the most or the biggest concern that I have with my clients. Oh, well, what happens after I move my loved one into an assisted living facility, am I going to be able to visit them? Absolutely. I really strongly encourage that. Don't back off. Don't be afraid to be involved in some aspect. Sometimes we'll see that communities or facilities are using Zoom. That's usually conducted by the staff. As sometimes outside visits, window visitations, end of life visitations is a really big topic right now. Advocate for yourself. If you feel like you need to see your loved one, you have concerns, then advocate and be willing to comply to all of the facilities regulations, and I'm sure that you'll be able to visit your loved one. Bringing your loved one home for a visit, that's still possible. However, families might run into the fact that after their loved one goes back to the facility, there might be some type of quarantine protocol that has to take place. So if you're concerned about abuse or neglect during the pandemic, I have included 2 resources to contact. The first would be Valley Caregiver Resource Center, the Ombudsman Program, which Susana talked briefly about, and then also community care licensing. So that is a state regulated, or that's a state program that license and oversees and conducts inspections for assisted livings. And then let me see. So I just want to kind of recap a little bit. So be kind, flexible, and present. I think that those were kind of the words that I came up with that would probably fit COVID-19 restrictions the best in this situation. So be aware of the safety protocols and be willing to comply with them when you're visiting assisted livings. Sometimes the large assisted livings and skilled nursing facilities, they're corporates and they're based outside of the area. So sometimes corporate might be based in Pennsylvania. And so their guidelines, you have to kind of be willing to understand that their guidelines might be different just because of their location. Develop good communication with the employees or the staff at the facility. So that is, I mean, of course, we all understand that communication is key, but it's so important in this time. Email is great. Ask for maybe the executive director's email. Even like the activities, anybody that you can come up with. Ask and email, be present. Email is 100% safe. So a great way of communicating. And then the last thing that I want to kind of talk about, and I've kind of talked about precautions, and I did talk to the state the other day. There is no firm regulations from the state. It's all recommendations. So at this point, the state just is putting out recommendations. It's not regulations. So, however, be an advocate for yourself as far as going to visit your loved one in a facility. Be an advocate for your loved one that is in the facility, and make sure you feel that empowerment that this is still your loved one. It's still your family, and you still have a lot of power. So, best of luck, and I'll turn it over.
Thank you, David. Now we have Dr. Bill Dailey. He's the former Gerontology lecturer in the Department of Public Health at Fresno State and the Department of Social Work at Fresno State, and also Fresno City College. So, Dr. Bill, take it away.
All right, let me get my PowerPoint up here. Let's see. Share PowerPoint. Well, it's great to be among you. It's great to continue to share information and resources. They're forever changing. But I have 3 slides, federal, state, and local, and then just some reminders. At the federal level, this used to be called the Administration on Aging, but in their infinite wisdom of collaboration and consolidation, several years ago, they took the Administration on Aging, the Administration on Developmental Disabilities, and the Disability and Aging Research Centers and put them under a new title, Administration on Community Living, which website is there for you. They produce a lot of information, and all of the funding for all of our federal programs that come down to the state and local level all comes from the federal government and the reauthorization of the Older Americans Act. So when we're talking about funding, this is where you would go look to see what are the critical issues at hand. They have great resources. The Older American Profile 2019 is a thumbnail sketch of our young old, or those 65 and older, who are going to impact over the next decade. We will have the largest aging population in the world. So you can look at the profile and see about economics and about healthcare, education, income status, housing, transportation, and great resources. They also have connections to all the older adult programs. So it's a great website to go browse and learn. At the state level, we have the California Department of Aging. It's important to participate in California. We have a state plan on aging, but our Governor Newsom has asked for a master plan on aging to come out next fall in January of 2021. So you can go to the website, engage.ca.gov, and look at all of the fine work that colleagues and advocates and individuals have given input to the new master plan on aging. Dr. Miltiades hosted a seminar many months ago, a year now, if I remember correctly, and we gave input to the master plan. So we look forward to see the huge master plan, since California will have one of the largest aging populations in the United States. So look at their resources. And when we talk about HICAP and ombudsman and in-home supportive services and so forth, they have great information and links on the California Department of Aging website, including COVID and the restrictions and other resources that seniors might need at hand. Oops, going backwards. Local level, we have the Fresno Area Agency on Aging. I highly recommend you visit their website. In the resource packet, I included their information and assistance handout that they offer older adults. You can contact them directly, or I always reminded my students and other community members to call the 800 number. You can call this number anywhere in the state of California, and that will connect you to the local area agency on aging. So it's 1-800-510-2020, and you can ask for information, assistance for any type of support service, such as meals, home delivered meals, and as Helen has already mentioned, there's a waiting list, which is a sad state due to the COVID situation. They all provide family caregiver support programs, MSSP programs, the long-term care ombudsman program, HICAP. So there are great resources for seniors to be able to find information. Senior home delivered meals. You can get all the information from 1-800-510-2020. And finally, just a few reminders. Time change. This weekend, we get that extra hour of sleep. Make sure you vote, because your vote counts for future funding for aging and disability programs. Medicare open enrollment ends December 7th, and we need a supplemental insurance plan to Medicare, since Medicare only pays 80%. So you need that supplemental plan. So seniors are bombarded on television with all the plans that may not be available in this area, but check with HICAP so they can give you information and resources about the best supplemental plan. If you want to change your plan, this is the time to do it. You have until December 7th. Lots of community resources in the guide that we're going to provide as a resource guide for you. I also put in that list our community centers under Parks and Recreation. If you go to the Parks and Recreation website and click on Senior Connection, it will bring up that list. But currently all of our community centers are closed, but some are offering home delivered crafts, virtual connections, and opportunities. I also highly recommend that we all call our elders or send cards, since we are basically social isolated. Some of us do get out and about, but we like to receive that personal touch phone call or cards in the mail. So here's my contact information, but remember to visit the federal, state, and local programs to see what are the continuing services that are being provided for us older adults.
Thank you so much, Dr. Dailey.
You're welcome.
Are connected to us, but we also have quite a few people who do not have a smartphone, do not have access to a computer. And if they do have these devices, they might not know how to use them. So quickly, I just have two tech services, GrandPad, which is very easy to use tablet for older adults, and Tech Goes Home is a website, even though it is Boston-based. There's a lot of information on there on how to use web-based services, even something as simple as how to order from CVS and Petco. Transportation is an issue for some older adults. And then we have older adults living at home without resources or family members, which I've mentioned. And Susana is going to be talking to us about the social services and resources that are available here for older adults. And just a final thought, now more than ever, self-care is so important. Susana is going to be talking a little bit about this. Just some things to consider. Actually talking to people on the phone, it sounds so, we don't do that anymore. We're more likely to send texts. But there is actually research out there that says if you call someone, you will increase your social connectedness. Not if you text them, but if you actually call them and you hear their voice. That is so important. It's also important just to remember to eat right. And I have exercise out there, which is even if you go out and get a walk early in the morning, or now they have a lot of online exercise classes that are free that a person can join, and just work on reducing unhealthy habits in order to promote our own health. So this was just a very quick overview of what's going on here in the Central Valley, and I wanted to end on a positive note. So I will turn the mic back over to Rebecca. And I will stop sharing.
Oh, thank you, Dr. Miltiades. So now we're going to open it up to a Q&A. So if you've got some questions, feel free to type in the Q&A box. And Maria and David, Dr. Miltiades and Dr. Bill will be happy to answer any of the questions you have. Let's see. Don't have any yet. Would anyone like to speak about anything in particular at this moment that you think people should really be aware of?
I would like to just to say it as we're waiting just here for any other questions. The importance of if we could, I'd like to, for anyone listening in today, the importance of not waiting for a crisis during your journey in caregiving. It's not. Sometimes we wait till there is an immediate there's a fall, a hospitalization, a health crisis. But we can start the conversation early. I know that is, I've had an opportunity to be with Valley Caregiver Resource Center for over 17 years and have seen families who, for various reasons, cultural reasons, sometimes distance, sometimes time, just sometimes the energy to have everyone come together and start that conversation. But I think it's so important that we start the conversation early when there is changes, because we're all aging. I think it's beautiful that we're all aging. I mean, I think we should celebrate that, and there is definitely some changes that we see as we're aging. So to have the conversation and to know that this is a way of honoring our loved ones, I just want to leave that it's never too early to start the conversation. Thank you.
Thank you, Susana. And speaking of conversation, for you and the panelists, do you have any key tips or ways that you suggest that families communicate with providers that you'd like to speak a little on?
I would probably suggest email would be great, simply because of this documentation. But also, when it comes to, I was working with this one family, and their mom was living in an assisted living, and when she went in, her teeth were great, but then they started kind of falling out. I think, again, through Zoom, you can't necessarily smell what's going on, or you can't necessarily maybe see those small details as far as like maybe bad dental hygiene. And so I would definitely ask those type of questions, especially when it comes to like small details and personal hygiene. With Zoom, you have to be really cautious that you can't, or be aware that you cannot you can't activate all your five senses with Zoom. And so I think that's something to be aware of.
Thank you, David. So we do have a couple of questions in the Q&A. We have one from Dr. Helda Pinzon Perez, and she says, thanks for your wonderful presentations. And her question is, what recommendations would you give regarding the administration of the hopefully soon COVID-19 vaccine? So I think she's asking what would be the best way. Do you think if a vaccine does come out soon, do you have any recommendations?
Well, I think part of the protocol has already been established by the government. When you listen to Walgreens pharmacies, note they're one of the national providers to give the COVID vaccine to all long-term care residents, but they'll caution that it's not out there, but they will be one of the first agencies to provide that to all long-term care seniors. So no one's really addressed the community seniors, which are just as even maybe 3 times, triple, double long-term care residents who in some respect are at a higher risk because they're out and about. But I'm sure we're going to have to follow the guidelines from the federal government where they're coming from. That doesn't mean that we can't advocate to our legislators how this should be done. I don't think anyone is looking at the big picture about who's going to get it first. Should it go to first responders? Should it go to our medical community, then seniors, then the community? It's a catch-22 issue at this point in time.
Thank you, Dr. Bill. I have another question. I I am 58 years old, so most programs do not apply to me, but I am currently facing homelessness. What is available to me? I have a service dog, so the shelters will not accept me.
Well, number one, if it's a licensed service dog, you could file an ADA complaint. We do have a lot of new services for homelessness in Fresno that we're now offering. So check with the city of Fresno about the new opportunities for housing homeless individuals. Again, you're going to have to advocate for yourself because you are an older person in some respects, and you have to deal with your limitations of the disability and having your service animal. So you'll have to advocate. Squeaky wheel gets the grease to acceptance. Even when I had my guide dogs, I always had to advocate because people are ignorant about when you can go into places. Dr. Perez could share a story that we experienced in LA when we were traveling together to a conference, and I had to assert my authority that this was a service dog and I wouldn't be charged extra and I could get on the next bus. So you have to be the advocate.
Thank you, Dr. Bell. I have another question. What are the symptoms a caregiver should be aware of in determining the proper steps to COVID-19 or flu-like symptoms? Does anyone have any recommendations?
I think this question is asking about the differences, but sometimes it's difficult because flu and COVID have a lot of the same symptoms, the coughing, the shortness of breath, the headaches, the muscle aches, the fatigue. But my understanding of it is if you've got COVID, it's worse. And sometimes you also lose the sense of taste and the sense of smell. And really the only way to be able to tell is if someone actually goes and gets tested. And there's people who've had COVID have told me that they just feel completely miserable, but they thought it was the flu. Then there have been people who think it's COVID, and it turns out it's the flu. So I would just say, go and get tested so you know what you're up against.
Also, the Department of Public Health has great information on the differences, but I think I'd like to, if I add something here specifically, that with stress, that we experience, anyone experiences, but here specifically to who asked this question, we are more at higher risk for illnesses, both physical, mental, and health. So I think it's important to reach out, because oftentimes a lot what caregivers are experiencing is due to stress. So knowing what your warning signs are, and sometimes what we say are early warning signs are not really early warning signs. They're definitely ones that are telling us we need support, and hope that today that we're able to know, okay, here are some differences. This is not my normal, and I don't ever second guess yourself. It doesn't hurt just to call and just check in with your primary doctor. I think that's really important. Sometimes we wait because it's so common for caregivers to say, I don't have the time, I don't have the energy or the emotional energy to make that call. And we are constantly putting ourselves in the back burner while it's going to catch up to us. So I think what Dr. Miltiades said, knowing what those differences, and I did see in the chat here, looking at what the differences between the flu and the COVID are going to be helpful. But I would just say call. If you're feeling ill, don't wait till there's a crisis, because what happens to your loved one, and often a question I pose to caregivers, what happens to your loved one if something happens to you? So I hope that today you're left here with that there's some wonderful resources that could help us during various stages in caregiving for those that are caregivers today. Thank you.
Thank you, Susana. Our next question is, what resources do you have for the caregivers that are taking on double the load of shifts, double shifts, if any? I think probably relief.
Well, I will say sometimes I've had clients take advantage of maybe just doing a short-term respite stay at an assisted living. That might be a good relief, simply because the loved one would be in a completely removed environment, and so that allows the family to get a break. However, could be a little bit challenging due to COVID-19 and doing that short transition. So it might look more like maybe a month, but anyhow, that might be a suggestion.
I'd just like to, as David said, bring back for those that are caregiving for an older adult or also caregiving for children. We do have many who are caregiving for younger children as well. Our services with Valley Caregiver Resource Center, we are able to provide services for those caregivers, a short-term respite that we have available in our counties that for the most part are low cost or free to the family caregiver, as long as they're caregiving for somebody over the age of 60 or caregiving for someone with a diagnosis of adult onset of brain impairment or cognitive impairment. So I would definitely connect. And again, this is not based on insurance. I know there's oftentimes it's not at this program like in-home support services. That's a separate county program through Medi-Cal, but we do provide the short-term respite for family caregivers. That could help if you're caregiving for multiple family members.
Thank you, Susana.
Mm-hmm.
So I do have one comment from an attendee just discussing the differences between the symptoms of COVID between she and her husband. They were very, very different between cough, chest congestion, and sinuses, and body aches, but they both tested positive for COVID. And she's asking everyone to be very careful, because if her employer hadn't insisted on them getting, if their employers hadn't insisted on them getting tested, they probably wouldn't have known it was COVID. So just a quick statement from one of our attendees. And our next question is, my daughter is in Indiana and works at a skilled nursing facility. She has to test 2 times a week. Are we testing that much in Fresno for COVID-19?
Yes, we are testing that much, or if not more. I do know that for long-term care facilities, they take it very seriously with their staff. They're kind of a little bit more hands-on as far as even suggesting to their staff to not go out to social events and so forth. So they really kind of, again, the burden is on the facility to make sure that the building is safe, and that definitely includes not only the residents but the staff themselves. And the staffs are the one that's coming in and out of the building. So of course there's more precautions taken. I'd probably say weekly testing for the staff, and I believe that it might be weekly for the residents as well. I think that that's pretty common in both assisted livings and skilled nursings. For the small residential care homes, that might not be necessarily that frequent, just because of the nature. There's only six to eight people in the home, but however, the larger facilities, it's usually once a week for both.
Thank you, David. I have another question here that says, my mother has a 1 to 2 minute cognition, Alzheimer's, and dementia. The ER recently separated us due to COVID-19 and reassured me that they had a room ready for her and that they would inform all nurses caring for her that she needs reassurance every few minutes and to be told I was waiting for her. I found out at about an hour and a half later that she was in a hall bed and the nurses did not know of her condition. Why do Alzheimer's patients not have the same right to an advocate that someone with disabilities would have? How can I find out my mother's rights in terms of having a caregiver with her at all times? I cannot find a resource on her rights.
First of all, I want to say I'm so sorry to hear. That just breaks my heart to hear anyone have to experience this. So I'm sorry to hear that your mother has experienced this. And you're right. She does have every right to be treated with dignity and respect, and has, as with anybody. And for her to not have that or be given that opportunity to be advocated, it saddens me. But I do want to say, depending on which hospital, I know there is advocates in the hospital. If there is a concern, a complaint in the hospital about their rights, you can speak to the Kaiser, I know, has advocates. You may look also at the Department of Public Health if there's a concern about her rights being violated. Also with Medicare, if there's a concern about her care, you can also file a complaint with Medicare. Okay, and that's definitely a right the Medicare recipient has. I'd like to hear from my colleagues, but these are some of the things that I'm looking at to be able to advocate for her. Again, the hospital to make sure that she speaks to someone there who you feel is not she's not getting the care or that she needs, and also the Medicare, as I mentioned.
I would just add, since you can't go backward, the important thing is to make sure something like this doesn't happen again. So I would make a referral to the Alzheimer's Association, because they can provide just a wealth of information for you. It might not be, specifically related to going to the ER, but they can provide so much other types of support that you would have them on your side if you were to ever end up having to go to the ER again. You would have some guidance. So definitely I would refer you to the Alzheimer's Association.
And then I would like to add that documentation is so important. So across the board, if you're working with your neurologist, primary care physician, to make sure that is noted. And then also even prior to admission, have a letter written maybe from your primary care physician or even your neurologist that, hey, this is what's going on with my mother, this is the situation, and this is our plan of action. And so therefore it can't be disputed. If you are proactive on that, then sometimes that might be helpful.
Thank you, David. Yes, I actually had come across an app somewhere that allows you to document your visits with your physician with their permission. They have to have you have to have their permission to record any visits. But I did come across an app, and I'll try to find that and put that in the resource guide. But yes, email documentation, so important. Even just taking a notebook with you to your visits, or going to just come home and type it all out or write it all out. Just keep a diary somehow. But yes, thank you very much. Any other questions? Okay, thank you, everyone. Dr. Kara Zografos is here. She is the director of the Department of Public Health at Fresno State. So she's going to just give us some closing remarks, and thank you, Dr. Zografos.
Becca. Good afternoon, everyone. Thank you all for joining us, and I'd like to thank the panelists for talking on a topic that is so relevant to so many of us, especially as our population continues to age. I also really appreciated the Q&A session and all of the resources that were offered, so thank you for that. I'd also like to thank Rebecca Wass and Dr. Perez for coordinating this webinar, and thank you all for joining us.
Thank you, everyone.
Thank you. Thank you. Thank you so much.
Have a
Thank
good
you.
day.
Thank you, everyone.
very much.
Thank you. A pleasure. Thank you.
Enjoy the rest of your day.
Thank you. Thank you, Doctor.